You should learn AI in medical school, but not for the reasons that you think. You see, most students use AI for writing, for learning things on the spot, for studying, and whether you think it's productive or just fucking rots your brain, well, that's really up to you. But I want to talk to you about how patients use AI every single day and why doctors hate it. I've seen so many doctors fight with their patients about what ChatGPT says, and the patients usually always side with their own research. It's kind of like a few years ago when patients used to Google their symptoms and deduced they either had a rash or armpit cancer. My dad the other day got into an argument with the family doctor. You see, my dad has hypertension, he's pre-diabetic, and he has high cholesterol. And so one day he got into ChatGPT, started typing in his symptoms, his blood work, and I'm not sure how he got into this conversation, but ChatGPT gave him instructions on how he could slowly get off his medications, his statins and his losartan. It gave him a simple plan, just exercise and diet. So when he went to his checkup, his doctor was understandably very pissed off because he was going directly against what he was saying. And my dad was pissed off because the doctor got pissed off that my dad made his own decisions. That is very common to see these days. When a physician tells their patient to just shut their brain off and listen to me, patients get understandably very pissed off. And then they go look into other resources like ChatGPT, like these fucking AI videos that they get on YouTube or Facebook, because they are much more comforting and give often easier solutions. As doctors, we should learn how to use AI alongside our patients to minimize the damage that these other resources can do without our supervision. Think about it. If you had control over the responses, the quality, the information, or when AI just simply stops and says, go see your doctor, I think your patients would be much more likely to trust you in the long run and not have to rely on these other questionable sources of information. That would likely make a bigger impact on their health than anything you can say during their appointment.